My name is Carl Charles Pierre, and the article I'm going to review is Locomotor Training with Body Weight Support in Spinal Cord Injuries. EMG improvement is more optimally expressed at a low testing speed. This study consisted of 4 participants with incomplete spinal cord injuries. As you can see on the chart, there was 1 HSC and 3 HDs. They all were at least 5 years post-injury. The main inclusion criterion was the inability of the participant to perform unassisted locomotor movements on the treadmill when body weight was not supported. Participants were excluded if walking on the treadmill with body weight support was not possible. The training program consisted of 18 sessions given during a period of 6 weeks with the goal to improve the participants' locomotor ability in terms of increasing walking speed together with a decrease in assistance and body weight support needed. Each session consisted of 2 times 10-minute locomotor treadmill training with a 5-minute break in between. Leg movements were assisted by 2 trainers, each sitting at one side of the participant. All participants were assessed weekly using the same 2 speeds, 0.5 kilometers per hour, which is the low testing speed, and 1.5 kilometers per hour, which is high testing speed. The EMG of 4 muscles, biceps femoris, rectus femoris, medial gastroc, and tibialis anterior, were measured bilaterally using surface electrodes. As you can see on the graphs to the right, all participants increased maximum walking speed and required less body weight support as the training progressed. After 18 sessions in 6 weeks, patients could walk with 0% body weight support while the walking speed was doubled. The low testing speed of 0.5 kilometers per hour proved to stimulate greater muscle activity than the high testing speed of 1.5 kilometers per hour, as we'll see on the next slide. Here is a visual representation of the low testing speed versus the high testing speed during the swing and stance phases of gait. As indicated by the white bars, there is greater muscle stimulation with the low walking speed. Based on the results of the study, the intervention is worth using. Although the equipment may be a little bit expensive, the prices may range from as low as $2,000 to over $20,000, though it is only a one-time expense that you are making. The body weight support system is very feasible, but it may take some time to set up. The study was conducted on patients with incomplete spinal cord injuries, but the intervention can also benefit those with complete spinal cord injuries. There are positive outcomes for patients who want to improve ambulation. Our patient who suffered a T10 incomplete spinal cord injury would be a perfect candidate for this intervention. The treatment effect size is very low. With only 4 participants in the study, there would need to be a lot more participants in the future to further confirm the data. As far as risk, the main risk to worry about with this intervention is falls, but with 2 assistants on each side of the patient, the risk is minimized. But overall, body weight support treadmill training at a low speed provides great benefits with walking and should be implemented in the plan of care of patients who have experienced a spinal cord injury.